There's been a lot of talk in the news about the new JN.1 COVID variant. Is this something that we should be worried about? If you've been a subscriber of this channel, I bet you know my take on it. But let's talk about it. Hey everybody, it's Dr. David. Hope you're doing well. Here we're rounding off the third year of COVID and heading into the fourth year. And we've gone from this pandemic to this endemic aspect of things, and COVID's going to be around for a long time, just like flu and all the other ones are going to be. At some point, will we probably see a SARS-CoV-3, and then all of this will start over again? We have to be open for that possibility that if there's that much of a major change, then it could be. But this is still part of this ongoing Omicron, which makes a difference. Now, mutations will happen all the time, and we've seen this happen time after time after time. Now, but for the last year and a half, 2 years, we've been in the age of Omicron. Every type of change, the mutations have still been Omicron. Okay, which means people who have had Omicron, or for that matter, if you've had the new booster from this fall that has the Omicron strain in it, it's still the same type of protection that is happening. Of course, protection can fade over time, and we'll get into that certainly. But as a whole, we're still talking about Omicron, which is why we're not. Well, you don't really hear anybody freaking out about it. Of course, you're going to hear the news will freak out about it because, of course, they want the clicks. Right. And of course, the government is going to be talking concern about it because, of course, they don't want to get anybody to get sick. And I understand that, finances and trying to take care of 350 million of us. I get it. Some very at high risk. But for the rest of us, I am not really seeing this as anything different than every other time for the past year and a half that a new one comes out. But I want to talk about this because I don't think it's any more dangerous. But we are specifically today talking about the JN.1. Okay, now, first of all, let's get our lingo straight. You would think after all of this time people would understand, especially people in the news or in the medical field. Okay, so a couple of weeks ago, one of the first things is, probably every news article is like JN.1, what you need to know about it. Okay, and from Yale Medicine, so this is their own newsletter, the following headline said this: three things to know about JN.1, the new coronavirus strain. This is not a strain. Strains relate to bacteria, okay? And, that's why they're not strains of animals, right? They're species, right? The strains have a specific meaning, and it talks about bacteria, okay? Now, also, SARS-CoV-2 is the COVID-19 coronavirus. You can think of that in a way as kind of like the overall virus, right? If you want to maybe throw the word strain in there, I guess we could throw it for that. But everything has always been SARS-CoV-2. It hasn't changed. Just mutations in the spike protein, that's what's changed. Spike protein. We'll talk about that more. Okay. Now, people are referring to this JN.1 as a new variant. And again, it's not. That's not what it is. It's a mutation, okay? They're even calling it a new variant, and Omicron was a new variant. This is a sub-variant. I don't know if they think that by changing the name or calling it something new or like that is going to get more clicks. I don't know. But, it sure would be nice if, at least the right terminology would be used, because I think that may scare somebody. Oh, there's a new strain out, and, and people go crazy over that. And I just think that could be a little bit misleading to the public. And there's certainly been enough misinformation out there from day one of COVID. It would be nice if we are not misleading people that we're trying to educate. Okay. Now, even coming back to the variants, remember we first had the original strain, we had Alpha, Beta, Delta, and now we're in Omicron. So again, those are the variants, and everything since that first Omicron, those are different subvariants. Okay, so now that we got the lingo out of the way, let's talk about what we do know about JN.1 and the collective immunity that we have. Now, it's true about half of the of coronaviruses are now JN.1, and you'll hear it say, "Oh, there's 50% of it." But if you think about it, all of them have to add up to 100%. So there's always going to be a predominant one. So just because this is the predominant one doesn't necessarily mean that it's any more dangerous to people. No, that slight change could make people less immune to it, even if they have prior immunity, and they may be more likely to catch it. But that doesn't mean it's any more dangerous. Okay, it could be more contagious if another person who has it, and they pass along to somebody else who has had waning immunity from past immunological boost, whether that's viral in wild, or whether that is through a vaccine. And then we know that it gets down, and then when the antibodies go down, then the first line of defense may not be there as well, and it takes a little time for it to build up, and that's why people may get sick. But of course, we're not hearing about the deaths and the terrible things that we were hearing about 3 years ago. Okay. In addition to that, we do also know that 95% of people, more than that, have immunity to SARS-CoV-2. Again, when you've had more than one exposure. So, when people talk about is 2 vaccines more protective than one? Yes, it is, because of the second exposure, so their memory kicks in. That's true also if a person has had COVID wild disease more than once. And it's definitely true if a person has what is referred to as hybrid immunity, which is having been exposed both to the vaccine as well to the virus, one at least, as part of this. Okay. Now, of course, we do know that the more times exposed, and especially if they're different forms, and again, the immunity does kind of like give a more globalness to it. Now, a person who has had COVID in the age of Omicron, especially in this past year, again, they should be pretty well protected. But if it wanes, it wanes, and that's something to be mindful of. So if a person said, "Hey, I did have COVID and I got over it back in 2020," and you haven't been exposed to it or had a vaccine since then, just be prepared. There is a relatively good chance you're going to catch it in some capacity. And of course, what is the thing that we're most concerned about a person catching it? If A, they are a high-risk person in terms of the likelihood of a hospitalization or death because they have a medical condition or their age or living in a nursing home or something. And of course, that is a certain thing. Or, of course, exposing somebody. So if there's a family member or a colleague or somebody you work with that is at high risk, then, of course, a person catching it, passing along to them could be a problem. And yeah, it's true also, one of the things is an immunodeficiency state. So some people may not mount a good immune response to it. Even people who have had COVID before, even people who have had the vaccine recently, if they are not immunological responders, they still may not have wonderful protection. Okay. But if a person does get COVID over time, again, it's important to recognize a few things, okay? Because I know I talked in a video recently that a person, if they choose to get a vaccine, they choose to get the booster, they get protected for a few months, and that's it. The immunity starts to go down, and as I reported from the huge population study in Austria, it seems as if people who've gotten the 4th booster, the people have been boosted over and over and over again, that they after several months may be more susceptible to catching COVID. And again, that doesn't mean death from COVID. That doesn't mean anything but catching it and potentially for passing it along. Okay, now let's talk a little bit about treatments. Okay, so the Paxlovid, that's the medication that's been around. I still advocate for it. I still see it work beautifully. Absolutely, the sooner you start it, the better. But people have concerned themselves about rebound. My feeling is the sooner you start it, the less likely it happens, because it blocks the virus from replicating. The more virus there is because you caught it later on, then the less neutralization that a certain amount of medicine can do. So catching it early, testing early, and if you're going to use it, then the earlier any treatment that you start, the better. We'll talk a little bit more about the different types of treatments as well. But as far as the in terms of the contagiousness, there is no evidence at this point that this is more contagious than other prior Omicrons. There is also no evidence at all that this JN.1 is more pathological or dangerous. So everything that you're hearing in the news is based upon assumptions. How do I know that for sure? Because it's only been around for a couple months. There's no research that's been done. So nobody can be claiming any research. And that's not the fault of the medical establishment. It's just not been around long enough to be able to study it. So assumptions are being made, just like I'm making assumptions here too. Okay, but obviously I think that the assumptions that I do when I take all of the resources together seems to be pretty on track, as it's been throughout the entire COVID experience of this world. Now, in terms of still let's talk a little bit, since it's been a while, about how we can deal with it, how we can minimize it, how we can minimize spread. So first of all, let's talk about testing. Okay, so if you would like to lower the risk of spreading the virus to somebody else, you test. You find out if you have it, and if you do, you take the proper precautions. Staying in quarantine for 5 days, wearing a mask, which we've now shown is the protection for you catching COVID wearing a mask. That's not so certain now. But in terms of spreading it out there, obviously, if you're breathing up close and most of it's being caught here, yeah, if you're wearing a mask, less is going to be put out into the environment. And therefore, and especially if it's a well-fitting like KN95, N95 mask, that's really has a good seal, it's going to be minimal exposure to other people, especially if the people you love are at high risk. Okay. Now, another thing, the rapid tests that you do at home, trust them if they're positive. Do not trust them if they're negative. In fact, the recommendation is that if you at home test negative, check again 48 hours. But I'll tell you, the first time that I had COVID, I checked 3 days in a row, it was negative, even though I had symptoms, and it wasn't until the fourth day that it finally popped up positive. So again, take that with a me. If you want to be more accurate the first time out, still the PCR test is going to be the more accurate because it's going to pick up smaller amounts. Of course, that usually does have to be done through whether you go to a pharmacy to get them to swab it, or a lab, or at a healthcare provider's office, so it's a little bit more inconvenient than just doing it at home. But I would be much more inclined to think that a PCR test being negative is a real thing than I would a at-home test. Okay. Now, there are also labs that run what are called full respiratory panels. So, and we know we've talked before that can you really much differentiate these days between COVID versus influenza versus RSV, especially an older person with RSV who doesn't do the wheezing as much as the babies do? It can be hard to tell. So there are panels out there that you can do all of the other adenoviruses, rhinoviruses, non-COVID coronaviruses, and one swab can check for all of those viruses at once. Why is that good to know? Because yes, it's good to know if it's not COVID, but also if you're like, yeah, but I am positive for adenovirus or rhinovirus, you know that that's what you have, and you have much less of a chance of having a dual, although it's possible with coronavirus or the flu as well. But if you test one positive and that's all it shows, that's probably what you got. Okay. But again, just as far as the recommendations, they're still the same. If you do have a positive test, again, avoid other people for 5 days. And then you could be out and about with masks for 5 days. I know not everybody's going to do that, but to me, this is a very different situation than either mask mandates and all the stuff that we went through earlier, and that we're hearing like in some communities like schools in Pennsylvania now that everybody masks up. And I'm not in favor of that. The thing I am in favor of is trying to decrease your known virus and exposing it to other people who may not want you to be giving them their virus. That to me is where masks make sense. Okay. Now, and again, I said, making sure it's a well-fit mask. People who wear gaiters, that's nothing. Even some of the cloth ones that people make at home, that's probably nothing. Even the hospital ones, because they don't fit very well on the sides, it's going to be better than the others, but still not fabulous. It's really that N95, KN95, that extra well-fit, thicker kind of mask. Okay. Now, what else? Of course, our immune support protocol, the high-dose vitamin A, the elderberry, the short courses of high-dose vitamin C and zinc, and echinacea, arabinogalactin. I know we've shared all of this on the channel before. I know that our Patreon subscribers and all of our patients have access to it in the patient portal. But again, starting those things as soon as possible. If I get exposed to somebody sick in the office and they give me a cough, I'm going home and I'm taking my vitamin A as soon as I walk in the door. Do not delay the vitamin A. Hey, that's a rhyme. Do not delay the vitamin A. Okay. But as far as that, as I mentioned, I do find that Paxlovid does work well. Let's talk a little bit about ivermectin. I still see some studies that show that it works. I see studies that show it doesn't work. Okay. And again, there's been no research relative to this JN.1, but I would certainly expect that if it works for a person, whether it was JN.1 or one of the other BAs, Qs, all the other Omicron ones, it should be the same. Okay. Now, but I do also want to report on something new, because there have been some newer studies, because one of the complaints of people who are in the pro-ivermectin group talk about, but the studies were only done for 3 days, for not 5 days. It was done at 200 micrograms per kilogram, not the 400, not the 600 that people who have been actively prescribing ivermectin, they've been using at least 5 days at 600 micrograms per dose. Okay. And that's really important. Okay. Because of course, just like with everything, not just the sooner you take something, but the higher the dose, more likely that it works. So I'm not here advocating to say that it does work, because I still do not have proof that that's true. But what I can tell you in the study, that was true also in the study that was done at the 600 mics per kilogram twice a day for the 5 days, it didn't show that it worked. But what it did show is that there were no adverse side effects compared to placebo. So everything in life, we always ask ourselves, what's the potential pro versus the potential con? And if somebody is getting a pharmaceutical grade as opposed to a veterinary grade product, can I look somebody in the eye and say that unless they have a medical condition, or they're taking a medicine where there's a specific contraindication, at least I do feel that a person who takes ivermectin, they're not hurting themselves. right? An argument could be made, hey, but what if they would have decided to take something that was more effective? And that's their own call. I know people swear by it, and I'm not going to deny those people what their experience has been. But I at least wanted to share where we're at today. So hopefully this is more information. Again, more than likely, there's not too much news here if you're a subscriber of the channel, but who knows, maybe you want to pass it along to somebody who's not, and then you can, of course, ask them to subscribe too. Have a nice day.